In today's video, we're going to talk about the true cause of 99% of back pain problems and why popular treatments day to day don't really provide lasting pain relief. Hello, my name is Arjen. I'm a chartered physiotherapist with 26 years experience treating back pain. I'm the owner of the Ross Physio Clinic. I created the Back in Balance Masterclass, and which is based on the spine balance method which I developed in the clinic over the years, which has helped my patients to finally find lasting back pain relief. Now, to try to explain the true cause of 99% of back pain conditions, I devised what I like to call the 4 stages of back pain development. First of all, we all, day to day, we go about our lives, we use our bodies in a certain way, hence at some point, we all, at some stage in our lives, we all develop muscle imbalances. And when muscle imbalances are light, that's fine, that's no problem, it happens to all of us. But once those muscle imbalances become too severe, in other words, there's a tug of war happening inside our body, left versus right, front versus rear. In other words, the one side that the muscle group is tighter, stronger than the opposing muscle group. So eventually that leads to the spine, the pelvis, thus the body, to be pulled out of its natural alignment. And that's when we end up in what we call stage 1. So the unbalanced use of the body can eventually lead to strong muscle imbalances pulling the spine out of its natural alignment. Now, once that happens, we go about our day-to-day life with those imbalances, constantly pulling the spine out of its natural alignment. Thus, what happens is that various spinal structures are under incorrect excess stress day to day. So that may last for a year, 2 years, 3 years, whatever, but eventually one of those structures will start to break down. It's a little bit like the last drop in the bucket before it overflows analogy. So something has to finally give. And once that happens, once those muscle imbalances get too strong, we end up in stage 2. That's what we call a physical dysfunction. In other words, the spine is pulled out of its natural alignment, which may mean your pelvis is too much forward, too much backwards, as I said before, or even that one side, the hip, is higher than the other side. So for example, the right hip may be higher than the left. So in other words, the spine somehow is not aligned as it should be. So during your day-to-day activities, incorrect stresses are being placed every single day. When you go about your normal day-to-day life, something eventually will have to give. So from stage 2, eventually, as I said, it may take a few years, but we end up in stage 3. So we finally then develop a back pain condition. Now, a back pain condition could be as simple as a locking joint, or it may be that the disc eventually starts to play up. Now, for example, let's say this is a simple joint. So the joint locks, so you run to your chosen back pain specialist. He or she will manipulate, or like chiropractors would like to call it, adjust, but it's the same thing, loosen off the stiff joint. So you get off the couch, stand up, you've been asked to move, and you say, hey, great, I can finally move free again, doesn't feel that painful any longer. Yes, there may still be an achiness, but great. So you get off the couch, you go about your normal day-to-day life. So what happens is that although you've loosened off that joint, yes, it allows maybe then whatever structure was inflamed, was irritated, the healing process to happen and the pain to settle down. But you go back to your normal day-to-day life, still having those muscle imbalances. So those muscle imbalances are still pulling the spine out of alignment. So you may have been told when you were on the treatment couch, we're going to put you back into place. You're out of alignment or something like that. You're being told, put you back into place. But that's not really what happens, because just imagine, as soon as you step off that couch, then those muscles will instantly pull you back where they want you to go. In other words, the spine will instantly be pulled out of its natural alignment again because of those imbalances. They still will pull the spine where they want it to go. So you go about your normal day-to-day life, those muscle imbalances pulling the spine constantly out of alignment. So those incorrect excess stresses will continue to play havoc on the spinal structures. So in other words, maybe in a few weeks, in a few months, that same joint will lock again. So you run back to your chosen back pain specialist, have another manipulation, adjustment, whatever you want to call it. Feel great for a while, but unfortunately it keeps coming back. Yeah, because those muscle imbalances are not being taken care of. The joint will continue to be under incorrect stress and continues to lock and cause pain. But it may not be a joint, it may be a disc. So a disc may start to play up. So it's vital that we not just focus, like most popular treatments, they focus on stage 3 and stage 4. So yes, it's important that maybe we need to treat the condition, we need to allow the spine to heal, thus the pain, whatever other symptoms will settle down. But if we don't focus on stage 1 and stage 2, then the pain, the condition that was causing the pain will keep coming back. And unfortunately, eventually, it will only become more advanced, the condition. So eventually, like a lot of people tell me in the clinic over the years, they've been seeing their chosen back pain specialist, and they went back every so many weeks, every so many months, but eventually it became more frequent, and eventually even that treatment did not provide temporary relief either any longer. And then it becomes harder to treat. So for any successful treatment, we need to focus on stage 1 and stage 2. So once we dealt with stage 3 and 4, then we need to focus on stage 1 and stage 2. So for any successful treatment, we need to work on those, we need to correct those muscle imbalances. Unfortunately, popular treatments only focus here, and thus the pain will be just reoccurring, will keep coming back. You have to keep running back to your chosen back pain specialist, and that may eventually stop working as well to provide you temporary relief. So please keep in mind that you need to correct any muscle imbalances. So if it sounds familiar to you, that you over the years you've been running forwards and backwards to your chosen back pain specialist, but the pain keeps coming back, that's the reason why. So we need to focus on stage 1 and stage 2. So I hope that is clear, I hope that makes sense. Any questions, let me know. Shoot me an email, leave a comment below the video, whatever. But just let me know any questions, please ask. I'm here to help. And soon I will send you another email with some other further useful information to further explain this. So hopefully I'll see you in the next video. Thank you for watching.